We all got like a urgent request to be at a meeting. They were expressing that there's just a great need in the hospitals for any extra help to do vitals, so I volunteered for that. So when I came to the hospital, I did not know who I was going to be assigned to, or I had no idea what I was going to be doing. So I arrived to the 3rd floor. I was just living that nurse moment, like I was enjoying myself. And then they asked me to sit in on a patient. I've never done anything like that. I wasn't sure what to expect. So I go sit in with this patient, and the patients that they're asking us to sit in with are patients that are kind of delirious or not wanting to stay in bed, not understanding where they're at. So it was pretty tough. It was a gentleman. He kept trying to, get out of bed, and I was just so afraid that he was gonna fall. All of a sudden, I noticed his wedding ring, and it just reminded me of my husband. So when I saw it, it just resonated with me, and I slowed down. I realized why I was put there. I just started talking to him, and like, your wife's with you, we all need you, they're praying for you, you can do this, gain strength through God. People here, we care about you, you're okay here. And I would just kind of stroke his hair just so he would feel the human touch. I wanted him to feel comfortable that for this time he could relax. Somebody's in there with him, somebody's caring for him. We all love our husbands and our children and our wives, the same way, and any kind of encouragement I could find to give this guy and do it for his family. That's what I would want if that was my husband laying there. It was life-changing for me. It really was. It's something I'll never, ever forget, and I hold close to my heart that Adventist gives me those opportunities daily to put myself out there.
I was covering the front that day. There was a group message that went out, and in the message they asked for help, that they were in dire need of help in the hospital. I didn't think twice. I just called really quick, and so after an 8-hour shift, I went straight to work from 5 to 10 at the hospital. It was very fast paced. The 5 hours felt like 5 minutes. I actually worked directly on the COVID floor, and I was helping the nurses. I was helping to change positions in patients to help their breathing. One of the tasks that I had to do was help clean a lady who had just passed away from COVID. She had a rosary on her. She had a Virgin Mary. And I just felt really impacted by what I saw. And I took the rosary from her and put it in between her hands, and I made sure her hands were together. And I placed a Virgin Mary on top of her hands. She was literally just there, and then she was gone. So I prayed, and I asked God to take her home and to help her family members resonate and to be at peace, that it was her time to go, that she was home. When I helped that day, it just opened up my eyes again that I really do belong here. I've worked in other places where we're not allowed to talk about religion. So here, when patients share stories with me, it is a huge blessing to be able to say, can I pray for you? Can I pray with you? I'm gonna keep you in my prayers. Anything like that, patients are just so validated. It is a huge blessing to be able to share my beliefs with my patients.
I was definitely aware of the surge. We had these increase in patients that needed our care. At the same time, we had less of us available to provide that care. And so that obviously was very concerning to me. And so as they began to talk about just staffing challenges at the hospital and the demands that were there, they reached out and said, who can help? And so I just really felt like if I could help and I could support and do something, that was really important for me to do. Probably about 20 years since I've worked inside a hospital, but I will come in and I can definitely make sure these patients are cared for, and I can relieve you so that you can go get a night's sleep, so that you can come back and do it yet again another day. Because they were all working overtime, all working extra shifts. The team that was giving us report was just grateful that we were there. So I took care of 6 patients and everything that they needed, IV infusions, medication administration, assessing them. It was a very busy night. There was no time for breaks. I didn't even realize till about 6:30 the next morning that I really needed to use the restroom. There was one patient that I sat with just for about 20 minutes and just talked with her. She was very sick. She hadn't seen her family. And so remembering that we're not medical beings, we're a whole being, right? And even though we were taking care of their medical needs, that other emotional being, that spiritual being, right? That part needed to be attended to as well. We really felt like there was pure love of Christ there. We absolutely had the opportunity to do that, and I'm very grateful that I work for an organization where I feel empowered to be able to meet the needs, and I don't have to worry about walking a certain line, but that I can see what does this patient need from me, medically, physically, spiritually, and what can I do to meet that need, and how can I do that to the best of my ability.